Have you ever come across a patient and thought, I think their scar is actually the reason for their chronic pain and the imbalances and symptomology that they're suffering from right now? Most practitioners tend to overlook scars or treat around them, simply because they haven't been taught a really efficient way and a really effective way to treat them. In today's video, I want to teach you how incredibly life-changing treating a scar can be for a client, not only mentally because it's visually better, but also physically in actually helping current symptomology that they are suffering with at that moment. Hi, my name is Maya Suzuki with ShinKyu University, and here in my clinic, Bumblebee Acutherapy, I treat clients all the time with my friendly dog, Nana, all the time for scars. I have patients specifically that come in for the appearance of C-section scarring, for numbness that they're having along their scarring, and also for scar work and also old injuries that are affecting how they walk and how they feel on a daily basis. In today's video, I want to show you my patient Kelly and the amount of effect that we were able to get with traditional Japanese acupuncture and moxibustion simply by treating her scar and the surrounding tissues. Now, this injury was extreme, and so if you have a weak stomach, I would recommend maybe skipping this video. For those of you who are really interested in how to truly treat chronic injury and to treat very horrific accidents, and for those of you especially who are working in orthopedics, today is your day. This is the video you want to watch, because traditional Japanese acupuncture and moxibustion is not good for just superficial and light needling. It is extremely effective for orthopedics. So let's get into the video. Now, I first met Kelly socially, and when I had first met her, she had suffered from a horrific horse accident. She was actually riding a friend's or a community member's horse, and that horse spooked, it got afraid, and fell on top of Kelly's leg and horrifically broke her bones in her leg. Both the tibia and the fibia were completely broken and sticking straight out of her leg. This is a picture of what her leg looked directly after the injury. And this is what happened after she went in for the first surgery. Yes, that is an old school screw, those screws, I should say, screwed into her leg because it was so horrific, they actually had to remove one of the bones from her leg. Kelly actually does not have most of the fibia in her right leg. It was completely taken out, and most of her weight, because of our anatomy, is then of course put onto her tibia. She also has screws put into her leg to help hold the construction of the bones and the bit of the leg together. But because of the muscle structure being somewhat connected, right, to the bone that had to be taken out, the fibia, she did have a lot of rebound of the muscle tissue up towards her knee when we were first working. Now, she went in for several surgeries because she did not get her surgical wound completely cleaned out after the break. So they actually had to go in a second time and clean out horse manure and dirt and actually several botfly eggs out of her leg because it was not completely cleaned out. You have to realize, like, this was a very horrific, horrible break and a horrible accident, and some things got missed. She was in a boot for over a year, and she had a really hard time walking. She walked with an extreme limp and had a lot of edema, inflammation, and pain in her leg, especially after helping her daughters around at the horse park or after a day of showing with her horses. And at the end of the day, her leg would be extremely painful, and she would have to do a lot of work on her leg in the evenings to try to just get it to the point where she could sleep at night. Now, when I first started treating Kelly, it was actually at a horse camp with my daughter, and I just saw her complaining about her leg and being in so much pain that I finally forced her to come sit over by our camper, and I was like, I'm treating you and I don't care what you say. It's very rare that I actually do that for anybody. I usually am very like, hey, I can help with that, but only if you want. In this situation, I just knew her so well, and I was so sick of seeing her in pain that I was like, you must sit down and I'm treating you. I don't care. Of course, I had all the paperwork and all that stuff. That was all taken care of. But literally with one treatment, her inflammation went down, I would say at least 50 to 75%. and the pain in her leg went away. She had hibiki sensation, which is like an echo of ki. Decha is one version of that. With every single needle that I did. I couldn't do moxa because we were in kind of a windy environment, and so it wouldn't work for the moxibustion. I did very gentle and light needling for her on that first day, and literally within 5 minutes of treatment, most of her inflammation and pain went away, and she was able to really walk the next day. And that convinced her that, oh my God, this might actually help me, and she started coming in for regular treatments at my clinic. Now, as you can see in the video, Kelly's leg was still definitely not in a great place because she is missing a bone. A lot of the tissue had actually collapsed into the leg, so the scar was very concave. And then she had a ton of scar tissue because both sides of the leg were heavily worked on throughout the surgeries. One of my first courses of action when always working with a surgical scar does not change from any other approach that I would do with any client, and I tell this to my students in ShinKyu all the time. You need to tonify what's deficient, disperse what is excess, warm what is cold, cool down what is hot, and remove any jaki that is present. Especially this fifth one, jaki is very important to be, you must remove it. If you have pain, you will have jaki. Jaki is pernicious ki, or a pernicious element, or an evil wind even. In Chinese, they say it as xie. Is very important to remove this in order to actually remove pain. So that's going to be the same for everybody's treatment. Now, before I go any further, I would love to ask if you treat scars in your clinic. Let me know in the comments below. All right, so continuing on with Kelly's treatment, I always work initially on removing jaki from anywhere in the vicinity of that scar because that's going to create pain. And it's also going to restrict and create inflammation around the joint. Now, the reasoning for this is actually quite simple. Whenever you have a pernicious element or evil qi, again, xie qi, any of these words that we might use to describe this, it is going to alert the immune system that we have something here that should not be here. And so the immune system will start to gather around it, and that is going to cause our inflammation. And this is, of course, something that we don't want, especially in and around joints, because it's going to restrict the motion of the joint by having an influx of blood that is now not able to properly circulate because you have the roadblock of the scar. So removing jaki is always #1 priority for any client, any situation I have, and that is doubly true for scar work. Then we always move on to relaxing and dispersing the scar tissue in and around the scar, and then tonifying along the scar line. A scar in the body, whenever you are cut open by anything, is always going to be at its root a deficiency because you created a place, opened up a place in the body that was not supposed to be opened and then closed it back together. Yes, the scar tissue strengthens around it, that is our yang, but at its core, it's going to be yin and deficient. So I always strengthen along the scar line. Bloodletting can also be used in some situations in order to release stagnant blood that is being created by the scar tissue, but really needles, even teishins and moxa are almost always enough in order to, again, disperse what's excess, tonify what's deficient, warm what is cold, and cool down what is too hot. Now, if you're unsure about the techniques I'm using in this video, I highly suggest that you set up an interview with me with ShinKyu University. Now, in ShinKyu, we cover all the techniques that I am showing on this video, and this is, of course, not the be-all, end-all of scar treatment. There's a lot more to learn besides a quick video, so please do set up a chat with me. Let's talk about your practice and how we can get you better in your clinic to help your community. Now, while I realize I haven't gone through every single thing that I did for Kelly's treatment, I am very, very happy to report that Kelly can walk almost completely without a limp. Even her surgeons are really surprised about how well she is doing. She rarely has inflammation or edema in her leg, except for, of course, when the weather changes. When you have metal in your leg, a weather change is always going to cause a little bit of pain and a little bit of inflammation because metal cools too quickly in comparison to the body. So that's something to always be aware of. And I do tell all my patients about that. But yeah, I'm very, very happy to report that she's walking very well. She is actually starting to ride again, which she thought she might never be able to do. and she is healing extremely well from the injury. Some of her scars are almost not even visible at this point, which is extremely surprising considering where she began in this journey, which again was this horrific break in her leg. Now, I use these same techniques that I did on Kelly to also treat my moms who just are recovering from C-section scarring, also anybody who is recovering from any scar at any stage. So I have been successful in treating C-section scars and helping women who went into early menopause get their periods back, C-section scarring to help women who are recurring at UTIs. C-section scar works also works wonderfully for women who have endometriosis and PCOS. Really, the reason for that is because it's creating a deficiency, of course, where we have some really important things as females physically, and so it's always, in my opinion, very important to think about the scar and if it's affecting the whole individual. If you have a patient in your clinic who has just had a shoulder surgery or has an old back surgery or has just had their appendix out, any of these scars are really great to work on. A great place to start if you're unsure about how to start work on scars is simply to do stick-on moxa along the scar line. It's a really easy way for both you to start treating your client and having your client treat themselves at home. Now, unfortunately, pole moxa does not work as well on scars, so I don't recommend it. Ideally, you do either stick-on or half-grade. Now, last but not least, if you do have teishanes and you do work with teishanes, they work amazingly on scars. So I highly suggest starting to play around with your teishane on the scar line and see if you get a great effect. All right, thanks so much for watching all the way to the end. I really appreciate you taking your time, energy, and effort to make your practice better so you can help more people. Now, if you're interested in getting a better understanding of how to truly switch your practice from TCM into traditional Japanese medicine and overcoming the barriers you might be facing, you're going to want to watch this video right over here.